Thank you. Thank you very much. Can you hear me now?
Yes, sir.
Yes, yes, sir.
Okay, thank you. And I'm very sorry to be connecting rather late. Incidentally, I'm in my village, still continuing the work on hypertension. So some network challenges here, but I've been able to at least get some network. I want to thank the organizers for inviting me to give the issue of hypertension and the problems we have at the burden of hypertension in Nigeria. I think I really will want to thank the group led by Professor Morisiwu for the deep interest you have in the subject of hypertension, especially in the area of looking for the plant-based medications for it. Why are you bothered? You are bothered because of the burden of hypertension. When we talk about burden, we talk about how many people are affected by hypertension and what is the general cost of hypertension. I'm not going to share any slides, but just to remind us, I know many of us in this meeting should be aware of the devastating effect of hypertension. Now, we looked at hypertension in this whole country. I was the principal investigator. We called the study REMA, removing the mask on hypertension. And we moved around the 6 geopolitical zones of the country. And what was our major finding? We found out that 4 out of every 10 adult Nigerians are hypertensive. And when you talk of adult, we included everybody who is 18 years and above. 4 out of every 10. And out of this number, how many people are aware that they are hypertensive? I just want you to pick these definitions because that will help us to put everything into the context. A lot of individuals are hypertensive, but they are not aware. So the number of individuals who are hypertensive and also aware that they are hypertensive, that is the rate you refer to as awareness. Now, after that, you talk about treatment. Those who are hypertensive, aware that they are hypertensive, and they are receiving treatment. That is the treatment rate. And then the final one is what you call the control rate. Those who are receiving treatment, but their blood pressure is under control. And when we say that their blood pressure is under control, we mean that their blood pressure is lower than 140 systolic over 90 diastolic. So there are 3 values I mentioned. First, what percentage of people are hypertensive? The second, how many people are hypertensive and are aware that they are hypertensive? The third, the number of people who are hypertensive and receiving treatment for hypertension. And finally, the people who are receiving treatment and their blood pressure is under control. So the first one, we got, that's the number of people, the percentage of people who are hypertensive, we got about 38%. That when I say 4 in 10, if you approximate 38%, that's about 40%. So to put it in the context, 4 in 10 hypertensive individuals, 4 in 10 adult Nigerians who are 18 years and above are hypertensive. And out of this number, just 60% of them are aware that they are hypertensive. The other ones are not aware. And the reason this is important is because hypertension is said to be a silent killer. i.e., if you are hypertensive, there is no symptom that tells you that you are hypertensive. Then after that, out of those who are aware that they are hypertensive, only about 30% of them are receiving treatment for hypertension. And why do we have so many people who may know that they are hypertensive, but they are not receiving treatment? One, it may be cost of medication, and it has even become more terrible now with the exchange rate. Antihypertensive medication are so expensive that a lot of people may be hypertensive, they are aware, but they cannot afford treatment. For some, the challenge is that they are receiving treatment where they want to receive treatment, but they are not happy with the side effect of the drugs, so they drop the drugs. So if you have this perspective, it helps you to remember that just about 30% of hypertensive patients are receiving treatment. Then out of this number, only 10% have their blood pressure under control. So I don't want to talk about so many things. I want you to hold on to these figures to tell you the enormity of the challenge and the problem we have as far as hypertension is concerned. And the reason we are bothered about hypertension is that hypertension is the main driver of a lot of complications, cardiovascular complications. For example, it's the main driver of stroke. It is the main driver of heart failure. It's the main driver of chronic kidney disease. So the reason we are bothered about all these numbers I've given is that, hypertension has its own major constraints and problems. So on this note, I want to welcome you to this discussion this evening, that the burden of hypertension should not be overemphasized because it is a major challenge. A lot of people are hypertensive, yet a lot do not know that they are. Even among those who know that they are, only very few are receiving treatment. Even among those who are receiving treatment, only very few have their blood pressure under control. So have this at the back of your mind as we listen to the group, the bioresource, development group, with this idea of trying to look for natural products that can support this, cascade and make sure that the unmet needs are reduced. So thank you very much for listening to me. And once again, I'm sorry for delaying the meeting, but this is just to start it off, and so that the other presenter who will talk about the use of natural product can now take it off from there. Thank you very much.
Thank you so much, Professor Odili, for such a wonderful presentation and opening to our event today. All right. Okay, please, Mr. Isaac, please go ahead.
Thank you, sir. Thank you. Yes, sir. Thank you so much. I heard that you said from the findings, 4 out of 4 adults, which are from 18 and above, have hypertension. Fine. But now the first two you said that those that are aware, that rate, I don't get the rate and the description of that rate. I got that of treatment rate that you said is a treatment rate. I just needed those two, the percentage of treatment rate, and the first one, those that are aware. Thank you, sir.
Okay, thank you very much. The major challenge with hypertension is that when you are hypertensive, you don't know. Hypertension does not give any symptom. When I teach my students, I ask them, what are the symptoms of hypertension? They say all manner of things: headache, sleeplessness. And I tell them that the answer is none. So the average hypertensive patient does not know that he's sick. So because of that, somebody is sick with hypertension and he's not aware. So we are usually interested in the number of people who are hypertensive and also aware that they're hypertensive, and the percentage is 60%. So if you get all the people who are hypertensive, just 60% of them are aware that they are hypertensive. The other ones are not aware, and that is why we have a lot of cases of sudden death in the country. Somebody is dancing in his son's wedding, and he slumps and dies. Thank you very much. I hope it's clear.
Yes, sir. Yes, sir. Thank you, sir.
Okay, thank you very much. Is the Prof?
Yeah, thank you, Prof. I just wanted to thank you again for this presentation, but I want to ask a question. You did mention the linkages between hypertension and other diseases. Can you please elaborate more? Because the pivotal nature of this particular illness is really a very disturbing factor, particularly the kidney and the other issues. Thank you, Prof.
Okay, sir. The worry we have about hypertension is that, like I said, when I say the main driver, if you hear that somebody's kidneys have failed, about 40% of kidney failure is caused by hypertension. The other ones is diabetes. You come to stroke. Hypertension is the commonest cause of stroke, is the commonest cause of heart failure. So it is those diseases that are caused by hypertension that is our main worry, and not just the elevation of blood pressure. Thank you.
All right. Thank you very much, Professor Odili, for that answer. Do we have one more question before we allow Prof to attend to his other function?
Yes, thank you, moderator. I have a question for Prof.
Okay, Professor Nadi, please go ahead.
Thank you. Professor, why is it that the available orthodox drugs have not been able to cure hypertension up to this moment? Thank you.
Okay, well, I will not explain. In fact, these are the kind of discussions I always have with Professor Iwu. Just like so many other diseases, there are also so many other diseases that, the orthodox drugs are available. They may not really cure, but control hypertension. There are just few cases of hypertension that can be cured, just about 5% of hypertension. That's the ones you call secondary hypertension, can be completely cured by orthodox medicine. But 95% of hypertensive cases is a mixed bag of so many things that cause it. So whether there will be a cure tomorrow, I don't know, but I don't think so, because it is a combination of so many factors.
Odili, for taking out your time to give us your expertise when it comes to the topic of today. We appreciate you so much. And at this point, we want to move on to our second speaker. Our second speaker will be taking us on the management of hypertension with natural products, and he is Professor Elijah Sukumba. Professor Elijah Sukumba is a professor of pharmacology. He is director of BDCP, that's Bioresources Development and Conservation Program. And just like I've mentioned, he will be taking us on the management of hypertension using natural products. Thank you so much, Prof. You have the floor.
Yeah. Thank you very much, moderator. I'd like to join the moderator to welcome us to today's seminar. And I'll be speaking briefly on medicinal plants that have been identified as possible remedies for the management of hypertension. Just have a few of them. Next slide, please. Medicinal plants have been widely used in the management of hypertension due to their multiple pharmacological properties. And they have been found to have complementary or alternative options. They have been found to offer or complementary or alternative options to conventional antihypertensive drugs. Need to yeah. The medicinal plants used for hypertension typically exhibit one or more of the following actions. Some of these have been studied through various experimental parameters, both preclinical and clinical studies have been carried out on some of them. And the following pharmacological actions have been identified with quite a number of them. So the ones that have exhibited beneficial effects in the management of hypertension have been found to have vasodilation properties. In other words, they relax vascular smooth muscle, leading to decreased peripheral resistance and lowering of blood pressure. Some have diuretic activity and promote increased sodium and water excretion to reduce blood volume. Others have shown antioxidant activity, protecting endothelial functions from oxidative stress. And another group has have shown inhibitory effect on angiotensin converting enzyme. These block the renin-angiotensin aldosterone system to reduce blood pressure. This is a very critical mechanism of action of some of these medicinal plants. Angiotensin converting enzyme is the enzyme that converts angiotensin 1 to angiotensin 2. And angiotensin 2 is a very powerful vasoconstrictor. So if angiotensin converting enzyme is inhibited, we have reduced effect of angiotensin 2, and therefore there is a net result of vasodilation. So this property is very important. And in conventional treatment, we have two groups of drugs that are used that affect this system, this angiotensin converting enzyme inhibition. You have drugs that inhibit the enzyme, and you have drugs that block the angiotensin 2 receptor sites so that the angiotensin 2 will not have access to its receptor sites. So these some of these medicinal plants have been found to exert effects on this particular parameter, inhibition of angiotensin, inhibition of angiotensin converting enzyme. Then we have some other drugs that can block calcium channel calcium channels. And these inhibit calcium influx into cardiac and vascular smooth muscle. Another group acts by blocking the sympathetic system. They are termed as sympatholytic effects, reducing sympathetic nervous system activity. So we have, I'm going to mention some of these examples of drugs that fall into these categories. The first one is garlic, Allium sativum. This has been found to inhibit angiotensin converting enzyme, as I've just explained, and therefore results in vasodilation and lowering of blood pressure. It also increases nitric oxide production for vasodilation. And gallium also exhibits antioxidant effects to reduce oxidative stress. So the actions observed with garlic include vasodilatory, hypotensive, and lipid-lowering properties. Some of the side effects that may be observed when garlic is consumed include gastrointestinal discomfort, bleeding, especially when a patient is taking anticoagulants concurrently. Next slide, please. The next one is a common plant. It's called Hibiscus sabdariffa and has several common names. It's called Roselle, Zobo, Bisap, Red Sorrel, and the African names include Zobo, mostly the Hausa name. In Igbo is Okorozo, and in Yoruba is Amuka. This particular plant is widely consumed in especially actually widely consumed not only in Nigeria but in other places also. And one of the products that we are marketing is we call IHP Bisap is formulated from this plant. It acts as a natural angiotensin converting enzyme inhibitor. It contains anthocyanins with antioxidant and vasodilating properties. Anthocyanins are water-soluble flavonoid pigments that provide different colorations to various fruits, vegetables, and flowers. It acts as a natural antioxidant and widely consumed in human diets for their potential health and anti-inflammatory benefits. Hibiscus also exhibits diuretic effect, so it's able to increase the excretion of sodium and water, and thereby reducing blood volume and lowering the blood pressure subsequently. The actions are mentioned there. It lowers both systolic and diastolic blood pressure. And some of the side effects associated with the use of hibiscus include mild diuresis, potential hypotension at high doses. When taken in high doses, we can have hypotension, severe lowering of blood pressure. Next slide, please. The next slide is olive leaf. As olive leaf, Olea europea, and it acts by blocking calcium channels and also inhibits angiotensin converting enzyme. It also has antioxidant and anti-inflammatory actions. This particular plant has been studied both in experimental animals and also clinically in human subjects. And there are proprietary preparations available on the market that combine this leaf with other natural products, medicinal plants for use as antihypertensive. So the actions of observed with this plant is antihypertensive property and also has cardioprotective effect. Olive leaf has been studied quite a lot, and as I mentioned, it has been incorporated in some proprietary medicinal preparations as for the management of hypertension. Some of the side effects observed with this particular plant, you have mild gastrointestinal disturbances and headache. Next slide, please. This slide is called Rauwolfia serpentina, the Indian snake root. This has been used for quite some time for the management of hypertension. The active constituent is resapine, and this resapine acts by depleting catecholamines from sympathetic nerve endings. specifically dopamine and norepinephrine or noradrenaline. So the plant has been widely used in the past as an antihypertensive, but it was also found to induce mental depression in the course of its use as an antihypertensive. So its use is no longer very popular. Some of the side effects especially include especially depression, which can lead to suicidal tendencies. We have nasal congestion. We have gastrointestinal discomfort, and also slowing of the heart. The individual may experience bradycardia. So these are some of the side effects associated with the use of resapine. So resapine used to be the mainstay for the management of hypertension in the past, but its use now has been overtaken by safer agents that are available. Next slide, please. This is celery, Apium graveolens. This plant has been found to have diuretic effect and therefore has the ability to reduce blood volume through increased excretion of sodium ions and water. It also has an inhibitory effect on calcium ion channels. The plant is rich in phthalates, which relax arterial walls and helps in lowering blood pressure. So the actions associated with this plant include vasodilation, reduce vascular resistance, and therefore reduction in blood pressure. Some of the side effects associated with the use of this plant include allergic reactions and photodermatitis in the exposed parts of the body, affecting the exposed parts of the body. Next slide, please. Next slide, please. The next plant is Camellia sinensis, which is commonly known as green tea. It contains catechins with antioxidant properties. It also improves endothelial function and has mild angiotensin converting enzyme inhibitory effect. So green tea is capable of improving vascular tone. It reduces blood pressure over time. Some of the side effects include insomnia, maybe as a result of the caffeine content, gastrointestinal irritation, due to caffeine content. So, but this is commonly consumed, and people are always advised to take them before bedtime so that it will not interfere with their sleep cycle. Although it's not everybody that experiences the effect on insomnia. Next slide, please. Well, this is just the summary of what I have presented. Medicinal plants used in the management of hypertension. It has given us the plants, the pharmacological actions, the mechanisms of action, the common side effects, all on this included on this table. So this is just a summary of all that I have mentioned. Next slide. In conclusion, many medicinal plants demonstrate effective antihypertensive properties through diverse mechanisms. While they are generally well tolerated, they can have side effects and interact with conventional drugs. So their use should be monitored, especially in patients on multiple therapies. If an individual may be on a conventional antihypertensive drug and may be consuming in large quantity medicinal plant like hibiscus, because it's a common drink. So in such situations, there is need for public enlightenment to caution patients, hypertensive patients, on the kind of teas or medicinal plants that they can take along with their medications. So this is the end of my presentation. Thank you for your attention.